Hi everyone. So giving you another report here from the American College of Rheumatology 2025 with the Go With Us to Conferences program hosted by AiArthritis. I'm Tiffany Westrich-Robertson, living with non-radiographic axial spondyloarthritis, and here at day 3, the final day that we're going to be here at the conference. But I wanted to give you a quick update on one of the sessions that I saw because this is a really important topic, and it was on cardiovascular. They called it cardiac immunology. We have reported back many years. You'll see Deb, shout out to Deb, one of our regular Go With Us to Conferences patient reporters with rheumatoid arthritis. We can link you to many of the past research that they've been doing on the impact of our heart when you have these inflammatory chronic diseases. So I really wanted to go to this session to just see what was new in that so we can add to the past Go With Us. So I did just pointing out there that they were calling cardiac immunology and cardiac rheumatology, just pointing out to the rheumatologists in the crowd of how important it is to recognize how much of a higher risk factor people who have chronic immune diseases like ourselves, how we could potentially have a higher risk for heart failure and heart disease. And they focused a lot on pericarditis, which is an inflammation of the lining of your heart, and then also myocarditis and the inflammation of the heart itself. And saying that, they started by talking about the heart and how there are leukocytes in the heart, and there are 12 times more of these than there are in skeletal muscles, and these are responsible for inflammation patterns. And since there's more that exists in our heart, then that makes sense why, if our immune system is out of control, then there's a higher risk for cardiovascular involvement. So then they also were talking about science currently happening in mice. So that's very early on. It's also called basic science, where they're looking at interleukin or IL. You may have heard of those if you're on any biologic treatment, and they'll say an IL, fill in the blank, that is targeting interleukin. So that's targeting a molecular structure of our bodies so that it's inhibiting production, and in some people and with our diseases that tends to respond better. And that's why this whole precision medicine is so important, to understand who's responding better to what. In this case, they're inflammatory markers that tend to be contributed to the heart and inflammation in the heart. So they were showing a lot of promise in interleukin 10, but then another person really went into the interleukin 1s and saying that, why is it so important? There were cardiovascular guidelines that were published in 2019, and they listed chronic inflammatory diseases like lupus, like any of the diseases that fall under the autoimmune, autoinflammatory arthritis umbrella, were actually at higher risk for heart failure than even people with hypertension. We always hear about hypertension can cause heart failure. You don't hear about it as much with our diseases. And in particular, I mean, I'm a person with hypertension or high blood pressure, and so that's just something that we should all really be aware of. And they wanted the rheumatologists in the audience to really take cardiovascular health very seriously. They also, going back to this IL-1 blockers or inhibitors, there is a lot of science that came out over the last few years that focus on how effective those particular drugs are if a person living with our conditions has pericarditis or inflammation in some level, in some way of the heart. And so there were recommendations in 2014 in an international position statement. I'm looking at my notes, that's what I'm doing. International position statement that says that IL-1 targeting is now the preferred second line option if there's heart involvement. And second line means if the traditional treatment protocol and steroids in particular aren't working, then this would be the next line. So if the patient is still not in control with the heart. So just good science to have, and just good knowledge to remind ourselves that these diseases are systemic and full body, and it's so vitally important to make sure that we're treating the underlying inflammation, even if we don't necessarily see it every day. If there are flares, then we still have disease activity. So just keep in mind and remember, we're here for you at AiArthritis as people living with these diseases, to keep you informed, connect you to resources, and thank you so much for going with us.